Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. If you've worked a day in a pharmacy, any pharmacy, whether it's community retail or hospital pharmacy, you've had to deal with one issue that is a challenge everywhere, and that is keeping expired meds off of our pharmacy shelves. Now, when it comes to expired meds, this issue is not only something that we have to worry about for the meds that are on the shelves, but with technology, we have to worry about all of the technologies applied to the medication use process and where we store medications, such as inventory control systems, automated dispensing cabinets, and others. So today I want to talk about one particular article in this Journal Club series. The article deals with expired meds in automated dispensing cabinets, and it's a fairly recent article that was published in December of 2020. When the Joint Commission comes to your hospital or the Board of Pharmacy comes there, Board of Pharmacy inspects your community pharmacy, they're going to be looking for expired meds, and they will cite you if they find any. So this is an important issue. We certainly do not want to dispense expired medications to our patients. So this ongoing issue is something we have to deal with, and hopefully technology and our software will improve in the future so that we have even better tools for tracking expired meds. For now, let me bring up my presentation and we'll talk about this particular article that was published. And this is an article about screening for expired medications and automated dispensing cabinets. And as I said, this is fairly recent, just the end of last year, 2020. And what they did is they decided to use different methods, different timing for looking for expired meds within their cabinets. So they did monthly audits. They did audits of just certain pockets within the automated dispensing cabinet. And in the end, what they recommend, their conclusion was that doing monthly audits and basically looking at all the meds and all the pockets in an ADC was the most effective way to track expired meds and make sure that we didn't have any expired medications in our automated dispensing cabinets. If I go a little bit deeper and talk about the issues here. So in this day and age, it would seem like it would be, with all the technology that we have, it should be fairly straightforward to have our computer systems track all expired meds, but it's not that easy. So if you look at the vendor software, they do have in the automated dispensing cabinets some features for tracking expired medications. And basically, when you replenish a pocket, then you can indicate the expired or expiration date of that medication that you're adding to the pocket. So let's take, for example, a simple drug, acetaminophen. And so you're adding some acetaminophen to replenish a pocket. There's a fast-moving item. You might have to replenish that pocket daily or multiple times in a week. And as you put the drug into the right pocket, you can also record the expiration date on that drug. Now, the issue comes in when you have a lot of different brands of Tylenol. So you're not always going to be able to order the same acetaminophen product. It might be the brand name or the generic. And it might be from different manufacturers depending on what your wholesaler has in stock at the time. So that pocket, especially for a fast mover where you have a high par level for something like acetaminophen, might have 2 or 3 different lots of medication with different expiration dates. So the system is not tracking all of those expiration dates on all those individual drugs. And so as they're removed from the pocket, it's hit or miss. You might have all the more recent medications coming out first, and then the other ones at the bottom of the pocket, and maybe they have a sooner expiration date, but they never get dispensed, and then you have an issue. So something that we asked our technicians to do at my institution was check the expiration dates for all the meds in a pocket, in a particular pocket, as they were being refilled. So you can check expiration dates for all pockets. This is a timely or time-consuming task, and that's pointed out in the article. Checking expiration dates with every replenishment, I think, is fairly effective. And then you always have to have a strategy for slow movers. So, for example, on an emergency standing orders that can be initiated by a nurse for a hypoglycemia event, we have glucose tablets in our automated dispensing cabinets. And those glucose tablets have an expiration date. Now, they might sit there for a long time because if everybody's doing a great job with insulin therapy, you might not have an issue with hypoglycemia on a particular nursing station. But if it does occur, then those tablets can be accessed. Now, if they sit there for a long time, they'll go out of date, and you need to replace those. And if you're not loading that drug in on a regular basis, then you might not know that those meds are expiring. So you have to have a better way of tracking those expirations on those slow movers. So just some things to consider. Now, you would think in this day and age that with all the technology, software, as I mentioned before, that our computers would be able to track all the expiration dates on all the drugs in an automated dispensing cabinet, and even in our other inventory control systems, our box pickers and carousels and other technologies. But that's not really the case. We have an opportunity here to improve how we handle expired medications within these automation products. Let me just take a moment to mention barcoding. So when the FDA first mandated a couple of decades ago that barcodes had to be included on prescription medications, they were considering doing more than just the NDC number. They also wanted to include lot and expiration. And there was a lot of debate about that. And the technology wasn't sophisticated enough at the time for the FDA to be able to mandate all of that information being placed on the prescription drugs, especially with a unit dose medication or a small vial where there isn't much space for doing that. And so what was mandated was just that the NDC number be included. Now, with matrix barcodes, something that you see here on this Detrol label or a 2D barcode, you can put a lot more information into a barcode in a small amount of space. And so I think the opportunity there is to include lot number and expiration date on every single product, and then work with our vendors to improve the software so that it's able to actually track and stack the expirations on meds in a particular pocket within our ADCs or within our inventory control systems. That way, you can track upfront lot numbers, for recalls, to find out what's in your machines or on your shelves for being pulled in terms of a recall, and then also tracking that expiration date for drugs on the shelves, in the machines, and up on the floors in the automated dispensing cabinets. So something to think about. We have a great opportunity here to really get away from having to do manual audits on pockets within our automated dispensing cabinets and having the computer help us with tracking of those expiration dates. If this discussion was helpful for you, then please like the video and subscribe to my channel, and I'll thank you for that. And in the meantime, stay safe, stay healthy, look after the health of others, and I'll continue to work on more Journal Club and other episodes, and I hope to see you next time. Take care.